The purpose of the video educational curriculum is to help you understand what health is and how your body functions. Furthermore, to help you understand what chiropractic's role is in the maintenance and restoration of your health. So hopefully by now, you've got some basic principles down and you understand them. You understand that your body is absolutely amazing. You are comprised of approximately 100 trillion cells of living, functioning tissue, different muscles, organs, and tissues that are all coordinated by one system called the nervous system, comprised of the brain, spinal cord, and nerves, and that the innate intelligence, this wonderful governing intelligence, the life inside the body, utilizes the nervous system as the communication system to coordinate all the different function. Also that the skull's job is to protect the brain, and the spine's job is to protect the spinal cord and protect where the nerves come off of the cord and swing out into the body, connecting the brain to all the different parts of you. And that if the spine is in a healthy position, there's no interference on the nerves. And if the spine is subluxated or misaligned, that is going to be representing interference, and it's going to be decreasing communication between the brain and the body, and you are not going to be healthy. You are not going to be functioning well if you are subluxated. And that is the bottom line. It doesn't matter if you have symptoms or not. If you have interference on the communication system, you are not going to be functioning at 100%. So I know that we've gone over all those points at length, and hopefully you're starting to understand this. So I have a question for you, and that is, has your family been checked? So if we understand these principles, that the spine is protecting the master communication system in your body, and that the spine is under a lot of different stresses and traumas throughout the course of life, and that the spine can be subluxated, you can be subluxated at any age, has your family been checked for subluxation? This really comes down to understanding the principle, because if we are waiting for symptoms to show up, we're not going to be bringing the kids in, for example, to get adjusted if they don't have sciatic pain going down from their low back into their leg. You know, if that's our understanding of chiropractic, if it's just a patch-up, fix-up, Band-Aid type care to alleviate pain and symptoms, then we're not going to be bringing the kids in. And they might be developing problems for years and years if they have subluxation in the spine that has gone undetected and uncorrected. Obviously, if that is going on, we would like to be aware of it. We don't want the kids to be developing problems or suffering from ailments that could have been corrected years before. We want to get the problems detected and corrected today and keep them corrected, hopefully for a lifetime. In my experience, people don't utilize chiropractic for a couple of different reasons. The number one reason is they don't understand the principle. The principle being that which we just discussed. They will be looking at chiropractic as somebody that you will go to treat back pain, neck pain, and headaches. Now we know that this isn't the case, right? We want to be utilizing chiropractic for wellness. We want to be remaining subluxation free for a lifetime. So if a person doesn't understand the principle, they're not going to understand why they would ever come in to get an adjustment or to get their spine checked if they're not having symptoms. Secondly, they're not going to be utilizing chiropractic if they understand the principle, but they don't really buy it. I feel like this is kind of a small percentage of people because the chiropractic paradigm and the philosophy of chiropractic and the science of chiropractic and the objective of chiropractic is really pretty simple when you think about it and when you understand it. So for a person to understand that but not really buy it, that has a lot of pre-programming that goes along with it. Now thirdly, people don't utilize chiropractic when health isn't a priority. When getting adjusted isn't a priority, meaning they understand the principle, they understand what it means to get adjusted and what it does for their body, but for whatever reason, time, scheduling, finances, things get in the way of their health being a priority. So everyone is on their own path in their journey towards health, their purpose, and their life. And your healthcare decisions are yours to make. And don't ever let anyone tell you differently. You are always empowered to make your healthcare decisions. So hopefully every practitioner and professional and doctor that you talk to and that you see for your healthcare is doing their best to educate you on what health is and specifically what their role is in your health. The word doctor means teacher, it means educator. So if your doctor is not teaching you what health is, then what are they actually doing for you? In the end, it's completely up to you whether you are going to be bringing in your friends, family, and your coworkers to get them checked to see if chiropractic could be a benefit to them and their health. Hopefully, what you've learned so far is something that you can impart to them that they might also, start to understand not only the benefits of getting adjusted, but how the body works. Because the more that you understand about how the body works, the better decisions you're going to make in the end. So if you have any questions about what chiropractic could do for your kids or your friends, your coworkers, your family members, if you have any questions about that, never hesitate to check with your doctor of chiropractic or your chiropractic team member within the office.